So today we learn about the external nose anatomy. Only the anatomy of the external nose. This is the first part from ENT, the nose chapter from ENT. So we know that our nose is triangular in shape. It is pyramidal in shape. Okay, it is pyramidal in shape with its root upwards and its base directed downwards. Okay, this is the shape of the nose, and it consists of an osteocartilaginous framework, and which is surrounded by muscle and then skin. Okay, it has an osteocartilaginous framework that is surrounded by muscle and skin. Okay, so first we come to the parts of the nose, the externally. So first we have the dorsum. This is the bridge of the nose, right? So this is the dorsum of the nose. This part is the root of the nose. Okay, in lateral view it appears something like this. This is the root of the nose. This is the bridge. This is the bridge or dorsum of the nose. Then we have the surrounding ala and alar grooves. Okay, ala and alar grooves of the nose. Okay, then we have the nares, external nares, that is the external opening, nares or nostril. Okay, the plural for nares is nares. Okay, so we have the nares, that is the external opening. Then under this we have the columella. This is the under surface. Okay, and from the columella to the lips we have some depression known as philtrum. Okay, it is like a triangular depression known as the philtrum, and surrounding in the exteriors we have this is known as the nasolabial fold. And this is the nasolabial angle. Okay, so these are the parts of the external nose. So the skin, so the parts of the layers we learned, it has an osteocartilaginous framework surrounded by muscles and then skin. So the skin of the nose, skin surrounding the nose. So first of all, nose has two parts. Okay, this is the nose. Suppose the upper 1/3 is bony. The upper 1/3 is bony and the lower 2/3 is cartilaginous. Okay, so the skin over the bony part, is very thin and mobile. It is very thin and mobile, whereas the skin surrounding the alar cartilages, the ala or the cartilaginous part, it is very thick and it is very tightly adherent to the underlying surface, hence it is not very mobile, and it has lots of sebaceous glands. Okay, you must have noticed that when you get blackheads, you get it over these areas only, not over the bony part. So it has a lot of sebaceous glands, and if the sebaceous glands undergo hypertrophy, it leads to a condition known as the rhinophyma. Okay, that is hypertrophy of the sebaceous glands around the nose. Okay, this is the external part of the nose. Now we need to remember that we had what, osteocartilaginous framework surrounded by muscles and then surrounded by skin. So we learned about the skin. Now we come to the bone, cartilage and muscle. So remember, we have three bones, four cartilages and five muscles. Okay, first I'll name them. Okay, three bones, let me name them. Number one is the nasal bone. Number two is the frontal process of maxilla, and number three is the nasal process of the frontal bone. Okay, I'll show these to you in some time. Then we have four cartilages. We have the upper lateral cartilage, the lower lateral cartilage, this is also known as the alar cartilage. Then we have the septal cartilage, and then we have the lesser alar cartilage, and it is also known as sesamoid cartilage. Okay, sesamoid cartilage. And then we have five muscles. Number one is nasalis. Okay, number two is levator, palpebrae, superioris, alacinaceae. levator labii levator levator labii superioris elakinasi. Then we have anterior and posterior dilator nares. Then we have depressor septi and we have procerus. Okay, and later we'll learn that procerus. Later we'll learn that nasal has two parts. Number one is the transverse part and another one is the alar part. Okay, so we have 3 bones, 4 cartilages and 5 muscles. Now let us see each one in visualization. Okay, first we come to the bone. Okay, see, this is the nasal bone. Okay, so first we have two nasal bones. Okay, this is number one and this is the other. These two nasal bones are fused in the center. Okay, they lie underneath the nasal process of the frontal bone. This is the nasal process of frontal bone. Okay, this is the nasal bone. Okay, the nasal bones are joined in the center. They are fused in the center. They lie underneath the nasal process of the frontal bone, and they are held in the center by this is the frontal process. The frontal process of maxilla. This is the maxilla. This bone is the maxilla. They are held in the center by the frontal process of maxilla. So these are the 3 bones. Next we have cartilage. We had 4 cartilages. Number 1 is the upper lateral cartilage. Okay. This is the upper lateral cartilage. Okay. This is as the position suggests, lower lateral or alar cartilage. Okay, this is the upper lateral, this is lower lateral, and the lesser alar cartilage or the sesamoid cartilage, it lies somewhere around here. Okay, so this is the lesser alar cartilage or sesamoid cartilage. Okay, same thing. And then we have the septal cartilage. I'll show it to you. Okay, so let me describe the cartilages one by one. So this is the septal cartilage. Anteriorly, it appears very small. Okay, anteriorly it appears very thin. It looks just like a small single line. But laterally, where we actually see the entire cartilage, this is the septal cartilage. Okay. So the septal cartilage, it is also known as as its shape it is also known as the quadrilateral or quadrangular cartilage. Okay, because of its shape. Okay, and it has 4 borders. It has an upper border that starts from the under the nasal bone. This is the nasal bone. It starts under the nasal bone to the tip of the nose. This is tip of the nose. Okay, this is the upper border, and it supports the dorsum of the nose. This was the dorsum of the nose, right? This was the dorsum. So it supports the dorsum of the nose. So in a septal abscess or after excessive removal of the septal cartilage, there occurs a depression in it. The cartilage cannot hold on to the dorsum, so there occurs a depression in the nose, and that is support of the nasal dorsum is lost, and that is known as a supratip depression. Supratip depression of the nose. Okay, it occurs especially after submucosal resection. After submucosal resection of the septal cartilage. Okay, this was all about the septal cartilage. Then we come to the upper lateral cartilage. That was the first cartilage that we started. Upper lateral cartilage. They also extend from the undersurface of the nasal bone to the lower border is the lower lateral or alar cartilage. Okay, so they extend from the undersurface of the nasal bone to the lower lateral cartilage or alar cartilage. Okay, and they fuse with each other in the center and with the septal cartilage in the midline superiorly. Okay, they fuse with the septal cartilage in the midline superiorly, whereas they fuse with each other in the center. They fuse with each other in the center and with the septal cartilage superiorly. Okay, then the lower free edge of the upper lateral cartilage, the lower free edge, this is the lower free edge. The lower free edge is seen intranasally, and the lower free edge is seen intranasally, and it has many names. Okay, it is known as Lyman vestibule, or it is also known as nasal valve, or it is also known as Lyman nasi. Okay, the lower, this is the lower free edge of the upper lateral cartilage. Lower free edge of the upper lateral cartilage is seen intranasally, and it is known by so many names. Now we come to the lesser alar cartilage. Okay, we can see it in this way only. The lesser alar cartilage, as we can see, it is the lower lateral or the alar cartilage. It is a U-shaped cartilage. Okay, it is a U-shaped, and it has a lateral crus and it has a medial crus. It has a lateral crus and a medial crus. Okay, and they are connected. And the lateral crus, they forms the ala. Okay, they form the ala, and the medial crus, they run in the columella. They run in the columella. Okay. Then next we come to the lesser. There is nothing much about the lesser alar cartilages. So we know lesser alar cartilage lies here. It is also known as sesamoid cartilage. They are usually 2 in number. They can be 2 or more in number. They lie above and lateral to the alar cartilage. Above and lateral to the alar cartilages, and the various cartilages, they are connected with one another and with the adjoining bones by perichondrium and periosteum, and most of the free margin of the nostril. This is the free margin of the nostril. Actually, so this is the nostril as seen from underneath. Here is the alar cartilage. Here is the alar cartilage, and most of the free margin, it is formed by fibrofatty tissue. Most of the margin is formed by fibrofatty tissue. Okay. Now we come to the muscles. The muscles in the nose, we learned there are 5 muscles, right? Number 1 is the procerus. This is procerus. Okay. We just need to know the location. Then we learned that nasalis has 2 parts. Okay. This is the transverse part of nasalis. Transverse part of nasalis, and this is the alar part of nasalis. Okay, so nasalis had 2 parts, transverse part and alar part. Okay, then we have this one. This has 2 heads. See, this one. This is nothing but levator labii superioris alacinaceae. Levator labii superioris alacinaceae. Then we have this. This is dilator nares. Dilator nares are 2 again, anterior and posterior. And lastly we have this. This is depressor septi. Okay, so we have 5 muscles. Okay, and they bring movement of the nasal tip, the ala, and the overlying skin. So these are procerus, the nasalis has 2 parts, transverse and the alar part. Then we have levator labii superioris alacinaceae. Then we have anterior and posterior dilator nares, and then lastly we have depressor septi underneath. Okay, that's all about the external nodes.